Hi, and welcome to the third talk in our carving series of presentations. For those who don't know me, my name is Jordan Lay. I'm one of the large animal vets based out of our Taupiri clinic. Today we'll be talking about Metabolics Part 2, focusing on down cows, so either where transition management has fallen over or the few odd cases you get each season. This is by no means an extensive presentation, and what is to follow is a brief PowerPoint. If you have any more questions, please feel free to comment them in the section below and someone will get back to you with a reply, or call your local Franklin Vets.
So here it is, the PowerPoint on Metabolics 2, down cows. This is just a brief overview of what I wanted to go through today. Like I said before, it's by no means extensive, and it's just kind of focusing on the key first aid that you guys can give to down cows on farm. So I wanted to start with talking about an approach to down cows, so just sort of looking at them and how you can work out what might be going on. We'll go over a basic summary of causes and possible treatment options. There are multiple different treatment options, but it's just working on what you guys might have on farm to use, and that's in a flowchart form that is available from Franklin Vet should you want a copy. We'll talk about when to call the vet, and lastly, very briefly, we'll go over down and care. So, down cows. We all know they can be very frustrating. I'm sure we've all had the down cows that look like it's a terrible prognosis. They've been down for 2 weeks, look really sad, and then suddenly they just get up. And then on the flip side, the ones that you've treated, they look bright and happy, can't find a reason for them to be down, and they just never get up. So they're time consuming, there can be multiple causes, and there are lots of products out there. So we don't have time to talk about all the pros and cons of the different products today, and if you're confused, feel free to talk to your local vet, but don't get overwhelmed, because during calving the most common reason for a cow to be down is milk fever. So, approach to a down cow. There are many different approaches, so just go with whatever seems to stick in your head. This one's quite basic, and I find it quite humorous to go down. A, B, C, D, E. So is she asleep? Is she breathing and bloated? If she's not breathing, I'd probably suggest stopping there. Is she calving? D covers disturbances, so that's kind of all your metabolic things. Milk fever highlighted again because it's probably the most common. And E is for emergency, which is just a sort of all catches all the other sort of problems that could be wrong, so covering things like fractures, your infections, and things like nitrate toxicity. So the two critical things to remember for any down cow is that there's allowed to be more than one thing going on, and the cause might change. So the initial cause might lead to secondary problems. For example, she's down with milk fever. We know the longer animals are down, the more muscle damage they get, which can lead to kidney damage. Or on the flip side, they can be down for something like paralysis. They can't move around and eat, so then they get ketosis. So just keep that in mind. This is another approach that I learned at uni that kind of stuck in my head. You do have the ability to sort of get it wrong with this one, but it's quite a basic. Happy front end, sad back end, so happy in the head, bright, alert, still wanting to eat. It's probably just something wrong with the back end, such as nerve damage and that sort of thing. On the other side is a cow that's sad all over, so looking at sort of a sick cow. She's sunken-eyed, she's not eating, she's dull and depressed. And so for your toxic mastitis, your metritis, and that sort of thing. I've got electrolyte/energy imbalance in the middle, because I'm sure we're all aware of the sort of different phases of milk fever, going from slightly staggery to looking like she's about to die. Cool, so what can you check on farm? So looking at down cow, you can check behaviour, that's pretty important, and what she's acting like. Is she acting very odd? Is she dull and quiet? Check the eyes, are they bright or sunken? The nose, is it dry? Is she wanting to eat? Look at that neck. It's a really good place to see that S-bend, obviously, your classical milk fever. You can do a skin tent, and if she's not dehydrated, it should bounce back straight away. Look at the abdomen, is she sort of bloated? Obviously look at the legs. It can be useful to pick her up in hip lifters briefly to check this out if she's sort of knuckling over or anything. Definitely check the udder for mastitis. The vulva is a key part to check if she's calved or not, or if there's any discharge. You can take the temperature and see if she's passing any urine or feces. So this is the flow chart that we were talking about. ask your local Franklin Vets if you want a copy. Like I said before, it's a very brief sort of overline of everything, first aid only. There will be other treatment options that you can look at, but we'll just sort of go through the flowchart in steps. Sorry for the quality, it's a little bit fuzzy, but bear with. So first is she's calving. Obviously if she's calving, you've checked out the back end, she probably will require assistance, or if you can't assist, call for help. Do your normal post-calving things. A drench of Starter Plus is important, especially if she's been down, and if it's been a particularly difficult calving or any that you would have to assist with, I recommend an anti-inflammatory such as a Ketamax or a Metacam. Obviously if she's still down and you're worried that there's something metabolic going on, give her a metabolic bag, blue or green or something in the vein, but whatever you normally use for that. Essentially check for tears and spears. So if there's a twin or a triplet, or if there's sort of anything that you can feel that's wrong inside her. If she's not calving and you're still at the back end, is there any smelly discharge coming from the vagina? So that could be an infection in the uterus. So obviously to treat the infection, we need to give her some antibiotics. This recommends Metabolics, but if you just have endomycin or depisilin or something, starting her on an antibiotic is essential. An anti-inflammatory such as Ketamax or Metacam is really important in these cases because they have other helpful effects, and giving her sort of a blue bag in the vein for her metabolics and covering her for calcium and a little bit of energy. Really important with these ones is that they can get really sick, so keep an eye on them. Sometimes they require fluids to correct dehydration, so if you're concerned, definitely ring your vet. Right, moving up the cow, something you'll all be very good at is checking the Artificitis, if there's swelling, lumpy milk, hot, that sort of thing. So obviously strip out the quarter, treat with endomycin. This is based on the theory if they're sick enough to be down from mastitis, you need to treat the sort of whole cow systemically. Give them a metabolic bag and call your vet for more treatment options. There are other treatment options. You can treat the sort of udder itself as well as systemically, so inject with Mamazin or your intramammary. I would recommend if the quarter looks like it's got black mastitis, so it's cold or discoloured, to consider euthanasia because it's quite hard to bring them back to that, and sometimes you don't want those bugs hanging around your farm. And then, like I said, there are other treatment options. Looking up the cow, does she have that classical S-bend, bloated, got a dry nose, constipated, your classic milk fever signs? You will on farm probably have your protocols in place for what you use for your milk fever cases, so such as a green or a pink bag in the vein. Importantly, get her up and keep her up. So the bags in the vein only last about, say, 6 hours, and that might not be enough time for her body to start making enough calcium, so you need to give her something longer lasting, such as a Calor when she's able to swallow, or a bag under the skin and a Starter Plus. Cool. If she's struggling to get up, it could be something like paralysis, especially if she's knuckling over. A good way to see this is if you put her up in the hip lifters and see what she does with her legs. Really for paralysis, you're just looking at treating them with anti-inflammatory, so a Ketamax or a Metacam, and giving her time, lifting her and stuff like that. Keep on top of the other things like I said before, and make sure she doesn't get any secondary problems, so keeping her drenched with something like a Starter Plus to keep that energy and minerals up. If she's fitting, grass staggers, so she doesn't necessarily have to be fitting, they just act very odd, crazy, usually they're quite dangerous and twitchy, so I've just put in this to remind us that they can be very dangerous. So it says you're 22 times more likely to be killed by a cow than a shark, so be careful with these ones. They do require probably a green bag, so that's a calcium and magnesium bag in the vein, and a yellow bag under the skin only. If you put this yellow bag into the vein, you will definitely kill the cow, so that's probably the most important of all the bags to remember, just under the skin. Sometimes they can require sedation in order to be treated, just because they can get quite dangerous, and then if they can swallow, a Starter Plus. If she's not fitting, they're acting a little bit crazy and odd, or drunk, like this cow here, might be ketosis, so they do things like lick the bars in the shed, eat dirt and clay and that sort of thing. So treating with ketol, or ketoaid, having a metabolic bag in the vein, such as your blue bag, or if you're very good at getting veins, you can go for a dextrose bag. Cool, so that was our flow chart, but when to call the vet. So pretty much if your animal doesn't fit any of the things we've just been over, it's just a bit of a strange presentation. If you're really unsure what's going on, you've treated her and you have no idea, just give us a ring. If there's no response within 6 to 12 hours, that's important. And if there's multiple down cows or it's a herd level issue, we're going to have to take a closer look at transition management and what's going on with calcium and magnesium as a whole. Remember, timing is an important factor for prognosis in down cows. The longer they're down, the less likely they are to get back up. So especially that no response, or if you're really unsure, don't be afraid to give us a ring. And that's just a note, if she's had 3 IV bags of calcium in the vein, it's probably no longer a straightforward milk fever, or it's not milk fever at all. And then finally, on nursing down cows, this is a very big topic. It could probably have a whole conversation to itself, but what I really wanted to emphasize here is how frustrating and time consuming down cows can be, especially the ones that don't get up with a bag in the vein. So they require big commitment of time and labor. So just really think about if you have enough time to do this, because if you can't do it adequately, the prognosis isn't very good. And we all know it's a very busy time of year, and so if you don't think you can commit to it, consider euthanasia. All down cows require food, water, warmth or shelter, and to be rolled and moved as often as possible. There's a note at the bottom of the flowchart on the use of hip lifters. What I wanted to say about these is that it's becoming a big welfare consideration, and there's lots of rules and regulations around it due to that. So if you're not sure on how to use them, please have a read up, and so you know what you're doing so you don't get caught out. There is a little bit of a note at the end of that flowchart as well. Cool, so thank you for watching everyone. I hope you found it useful. Again, please post any questions you have in the comment section below, or feel free to contact your local Franklin Vet Clinic for more information.